Hello, everyone, and thank you for attending today's webinar, The New Era of Care. Unfortunately, Chuck Schlom couldn't make it today. We have Rakesh Anagundi, Director of Product Management and the Ryzen AI Product Lead at AMD, filling in for Chuck. We also have best-selling author and leading healthcare speaker Nick Webb with us today. Before we begin, I want to cover a few housekeeping items. At the bottom of your audience console are multiple application widgets you can use. If you have any questions during the webinar, you can submit your questions in the Q&A box, and they will be answered at the very end of the presentation. You can also expand your slide area by clicking on the maximize icon on the top right of your slide viewer. If you have any technical difficulties, please click on the help widget for assistance. At the end of the webinar, there will be a short survey, and if you can please take a moment to fill that out, that'd be fantastic. I'll now hand the deck over to today's speakers, and I hope you enjoy the webinar.
Oh, Rakesh, you might be on mute if you just want to pop off mute real quick.
Oh, thank you. I think that would be needed. Hey, thanks a lot. I'm very excited to be here. We all know that healthcare is a juggernaut of an industry. And on top of that, the impact that it has on our everyday lives is impeccable. So I'm excited to be speaking about what role we in AMD are going to be playing to improve the experience of personnel in healthcare. I would warn you that a few parts of my talk is going to go a bit technical, but I'll try to level it up to drive home the point as to how AMD solutions can really deliver a better user experience for the healthcare industry. So just going through some of the top use cases in healthcare industry, right? We are just coming out of the COVID era. Just before the start of the webinar, we were talking about, hey, Zoom fatigue, how often we are all on the video calls, right? Telemedicine had peaked in the COVID era, and it's here to stay with us, right? Especially what it opened up to the world is the reach that a healthcare provider can have to the distant parts of the world was amazing. So in that case, we continue to believe that the telepresence and the remote medicine continues to be an important use case in the healthcare industry, right? We all are very familiar with the amount of data that's generated in healthcare industry, be it in your doctor office, your healthcare providers, or even in the different research and development that's going on in the healthcare industry, right? The amount of data that's generated by healthcare industry is immense, right? And we want to ensure that we equip all the AMD customers in healthcare with the right hardware, which can meet the needs of this changing dynamics, right? AI is a thing now. Everybody talks about AI, more specifically to healthcare. AI and the use of it, I would dare say, was probably reserved to the elites of the industry. But based on what's happening, what's transpiring, it's flowing down the stack and actually adding value to everyday interactions that we're going to have in the healthcare industry. And I'm going to dwell on it a little bit more later in my presentation. Security and compliance, right? Rightly so, healthcare is a very well-regulated industry. So pairing that up with the right amount of compute needs is going to be paramount. And when we look to deliver solutions into this market, compliance and data security rightly is on top of our minds. So with that background of different use cases, I want to just talk about how we are thinking about delivering the right hardware to the healthcare industry, right? I warned you, I'm going to get a little bit technical here, but again, tying it to what makes the AMD Pro processors specifically stand out when we are talking about these different use cases, right? Currently, the Pro processors have 8 performance scores. And what does that mean? One of the key KPI that we look at is the multitasking performance, right? Again, whether you're a healthcare provider or you are doing some R&D in healthcare, you always have a laptop in front of you. You have many tabs open, right? The responsiveness when you go towards one screen to another screen, when you're looking to data to another data, it needs to be seamless, right? We've done some user studies where if there is a lag of 10 seconds and 20 seconds when the user is trying to switch context or look at different data, it just spoils the whole workflow, right? So having these number of processors, not just the number, but the optimizations that we put in to make multitasking seamless is going to be really important. And not only multitasking, when you have so much of these horsepower in your processor, we talked about big abundant of data that's being generated, right? Bunch of this data could be crunched in the cloud, but there will be fair amount of data crunching that happens locally on your device. And these processors are primed to deliver a good user experience on different kind of workloads or number crunching or regressions that you want to run locally on your device. And we talked about security. And at AMD, we are uniquely positioned to look at security from a wide gamut lens, right? We are a very healthy providers to the cloud, where our cloud solutions also have inbuilt security features. But coming to the AMD Pro processors, which are primarily in your client devices, we think about security at every layer, be it firmware, be it hardware, be it software. And our Pro security solution ensures that the surface attack across these different layers is vastly reduced. And this basically translates directly into the intangible benefit that a user of an AMD processor would get about protection, data protection that's locally stored on your device, be it your patient's records or different databases that you are accessing, right? Specific technology that I would call out that's built into our Pro processor is our memory card protection, where the data stored is highly encrypted. So even if there was some surface attacks, the encryption built in makes sure that the data is still protected and not exposed. And the FIPS certification that comes with all our AMD Ryzen Pro processors, right? Great processors and having high level of security is extremely important. We pair that up with, especially for our Pro processor, to deliver longevity, right? And it boils down to how these processors are actually selected when they're fabricated out, right? We pick the dies in the fabrication units, which are known to provide a longer lifeline. That's how these Pro parts are made. So that's a little bit of tidbit on how we place emphasis when we are actually fabricating these processors so that these deliver a higher longitudinal lifespan, and that directly results in the usage, right? So when you buy an AMD Pro processor, you're assured of having greater than a year of longevity. A year is just a basic call out, right? And that translates into the investments that you make into all these purchases. It's protected for a longer period of time. These were the three basic pillars, right, on how the AMD Pro processor delivers a superior solution to the healthcare. And what's exciting is the new AI technologies that we are integrating in the new era of AI that's ushering in for different use cases, right? As a hardware provider, we are in a unique and also tough positions where we need to make investments well before these use cases become prime time in a user's lifetime, right? Or in the user's usage, right? If these AI use cases are going to become prominent in a year from now, the investments from AMD and hardware provider needs to happen a long time ago. And that's what we are doing with our next-gen Pro processors by providing an integrated AI engine, right? So we talked about the use cases. We talked about some basic features and the pillars that make our AMD Pro processors the best choice for healthcare. Now, let's look at about what's happening in AI healthcare, probably at 1,000 feet level, right? So AI in healthcare, from data is projected to grow at 30%, 38%, 40% over the next 10 years. Right? This was a quote that we picked up, but I'm sure it's going to go at a rapid pace higher than that. And why is it so, right? That, as I mentioned, the data that's been produced in healthcare has been increasing, but now we have tools with like large language models, different AI models, which are becoming more democratized and being ability to run on different devices, which means that some of these features, which were again reserved or not available in all devices, are falling down, which means that a local healthcare provider or an administrative staff in the hospital or an R&D or a remote lab scientist can all get these new AI features onto their devices, which is going to pick up and have this eruption of AI use cases in healthcare, right? And one of the key benefits that it brings in is automation as well, which increases productivity. And I'm going to talk a little bit more about that. And again, the strong belief that we have is everything can run on the cloud, but all these use cases have to waterfall to your client or to your edge device to provide a better user experience. And we can dig into why in the next 4 minutes. Okay, so now what are those specific use cases that we think are going to take off with Ryzen AI, which is our integrated engine or our AI engine, which is built into our processors? The data analytics was, again, we talked about the plethora or large quantity of data that's generated in healthcare. And when the compute happens on your device, you want to make sure that the analysis, the regression, and the different modelings that you do on your device is very fast. You cannot wait for like an hour or two, which is going to kill productivity. So the core compute strength of our Ryzen AI powered processor is going to be important. The second one, which is of personal relevance to me because I've experienced this, is a virtual AI assistant. Right? It should be no surprise to anybody that the amount of the time, especially the healthcare providers, spend in entering data onto the device is immense. I've heard stories about where doctors spend 80 to 85% about entering the data, then conversing with the patient, right? The power of AI on your local device can free up the doctor to actually capture all the conversation, provide all the analysis locally when the doctor can focus on patient interaction. And then when the visit is done, he could look at the device, which will have the summary of the interactions, highlight key points and suggestions for the provider who can act upon it. And I'm really excited about that use case. And especially why it is more valuable in the client is when something runs on your device, the latency, how fast the data and how you can converse is going to be a lot more smoother and provides a better user experience for the provider. We talked about computer vision, right? Better lifelike teleconferencing could be possible with an AI-equipped PC, right? And when you're trying to do more analysis in your R&D, trying to find anomalies in your different reports, that's where running local AI can help the doctor arrive at the diagnosis a lot sooner. And the fourth one, again, it's going to be more providing more personalized care because your PC has more information, it has more AI capabilities. Whenever the healthcare provider or the administrative staff is trying to interact with the patients, providing them with the real-time information, more personalized too for a patient, for example, can result in a lot of high-quality conversations. So, I'm going to wrap this up in a couple of minutes, but this is going through, again, reinforcing the fact that why a PC equipped with this great AI capability is going to be important because you can run everything on the cloud, which is what is happening now. Most of these AI models, AI training and inferencing currently is happening in the cloud, which means that a lot of data has to be shipped back and forth between the cloud and your device, which is perfectly fine for some of these use cases, right? But for some of those use cases, which requires either a more secure experiences, a more low latent experiences, this is the world where we see us transitioning into. If I can go to the next slide. It's going forward, we strongly believe that the client device or the PC is going to be the best friend with cloud, where majority or a high-powered compute can still happen in the cloud, and low latency, highly secure workload can run on the PC. And when they interact together, they can provide a magical experience, right? One of the examples that I throw out to people is, hey, if you ask your PC, hey, can I get the report from Jesse that I looked at it last week? The cloud doesn't know who Jesse is. The cloud doesn't know what you did last week, and it doesn't have to know, but your PC might know based on the metadata it has stored, might know who Jesse is. It might have all the record, and it can pull up the right document to send it to the cloud, which can do the crunching and give the response back to the user, right? So if I have to wrap this up, the power of Ryzen AI for healthcare resides in the fact that it's built with highly performant cores, be it CPU, GPU, and IPU, which is very suitable for different kind of workloads. An immense focus on security and privacy when it's required, when it's running on your client, on your client device, which is of paramount importance. And truly what's going to drive the need for this PC, apart from security and performance, is it's going to become expensive to run all of these workloads on the cloud, right? There's some anecdotal data about, hey, 30 minutes meeting summary can cost you 20 cents, right? Or you want to summarize a document, it can cost you 2 cents. But when you're running on the right equipped PC, bunch of those inferencing costs can be delivered free if you make an upfront investment. So that was a quick roundup. I appreciate the opportunity to be here and share my thoughts with you. I'm going to hand over Nick, who's going to take us to some of our exciting talk next.
All right, y'all ready for me? Thanks, everybody. I appreciate the opportunity to share some ideas with you today. And thanks so much. I'm real excited about what AMD is doing with, this was a no-brainer, right? Where we're going to move right away to the development of technologies that support the speed and the multifunctionality and security. And it's a great thing. I got to get one of these for our innovation lab. So what I want to talk with you today is really about the future of healthcare. And when you think about the future of healthcare, it's really easy to think about the future of healthcare, looking at it from the perspective of reimbursement, the epidemiology of chronic disease, the impact of anticipatory genomics, the impact of hyperconsumerism, the impact of staffing shortages, the impact of new economic and value models. It's really easy to look at the future of healthcare and really assume that it's uncertain. In fact, the word that you associate most often today with the term healthcare is uncertainty, which to me is actually kind of surprising. Because, when we think about the future of healthcare, it's really not so much about uncertainty, because the truth of the matter is we're pretty certain about what the next 5 years look like. There are nuances for sure. And there are some areas that have less plasticity, like reimbursement and regulations. But in the major areas of consumerism, emerging technologies, human experience design, new economic and value models, we know what the future of healthcare really is. So I would suggest that we replace this concept that the future of healthcare is really about uncertainty and really realize that the future of healthcare is about complexity. But the good news is, if we can understand the genesis of complexity in healthcare, it gives us the ability to sort of decipher what's inside this complexity so that as healthcare leaders, we can apply these known insights in a really practical way to be able to run superstar organizations, to be able to attract and keep mission critical talent, to be able to significantly not even just improve clinical efficacy and patient safety, but also to improve the human experience that is healthcare, right? We can do all of this stuff. The challenge that we have right now is that we have to be willing to lean into complexity. So let's take a look at how we got here in the first place. When I started in healthcare 40 years ago, I started out as a medical technologist. I invented one of the world's smallest microsilicone implant that goes here into the vertical puncta for the treatment of ocular surface disease. I invented one of the first wearable technologies and dozens of surgical technologies. And during that time, it was honestly pretty easy to be a great innovator because things were slow and the nature of things were disconnected. They were small. And then things started to change. We started to transition into a new phase in healthcare. And this is the phase that we all talk about. It's hard to talk to anybody or to read a journal in healthcare today without reading the concept around disruptive innovation in healthcare. But you know what? That was like 5 or 10 years ago, right? I mean, we've passed on disruption quite some time ago. And when you look at disruptive innovation, I think the best way to look at it is that the size of change grew exponentially and the speed of change accelerated. And of course, a lot of that had to do with the internet and connection architecture and other enabling technologies. But there are societal changes, there are clinical changes, there are many, many changes that made up for this period, this era of disruptive innovation. Excitingly, during this period of time of disruptive innovation, we begin to realize in healthcare, and in my consulting practice, we work with all of the top healthcare organizations, drug companies, device companies, insurance companies, and they're all challenged with the same problem. And that is, how do we understand the changes within complexity, and how do we leverage those knowings, those insights, in a way that moves our organization forward while serving our employees and the incredible patients that we ultimately impact. And that really requires that we understand these changes of disruptive innovation. So today, we are now in a state that I call chaotic innovation. Now, the good news is that if we're willing to really lead our industry and just about everything we want to lead, maybe our goal is to lead as the employer of choice. Maybe we want to have the highest scores in terms of patient satisfaction. Maybe we want to drive predictable and sustainable revenue growth. Maybe we want to significantly improve the returns on stated strategic priorities. It doesn't matter what you want to achieve in healthcare. You will achieve it by understanding the superpower of chaotic innovation, the elements, the DNA of what makes up this change. I guess if there's one thing that I would like for you to take from my brief talk here this morning, is that what I'm finding working across hundreds of organizations in our consulting practice and having met with thousands and thousands of healthcare leaders in the last 12 months, is that we need to be willing to have the emotional and spiritual fortitude and willingness to lean into the blur of complexity. Because as weird as it may sound, the only safe place for us to be right now is inside the blur. The organizations that are fearing the blur, those organizations will ultimately fail. In other words, I guess what I'm saying is, in a time of differentness, a commitment to legacy or sameness is like a super bad idea. And we have the data to prove it. So what's inside the blur? Here's what's inside the blur. Number one, hyper consumerism. You know, for the last decade, we have been pushing this outdated concept of patient experience. The term PX is widely used. We're having people get trained as certified PX experts. We're developing programs around patient experience, keyword patient experience. And in my opinion, and from what we have witnessed mopping up after some of these failed initiatives, is that patient experience, monolithically, just looking at the patient, is a setup for failure in my view. And here's what I mean by that. Is that patients are no longer willing to wait for an hour in a waiting room like a patient. They don't want to have some special sort of Department of Motor Vehicle experience just because they're trying to access life-critical healthcare interventions. They are consumerized today. And that means they want friction freedom. They want relevancy. They want transparency. And as it relates to the digital realm, they want to be able to communicate with their provider asynchronously through different forms of asynchronous telemedicine. They want to be able to easily leverage telemedicine in a way that's moving towards this new era of telemedicine 2.0, which includes a wide range of new sensors. In our lab, we've been working on new technologies that use facial expressions and other aspects of the facial anatomy to be able to identify potential medical conditions. Other innovators and researchers are looking at telemedicine to be able to use this visual image that you see on the screen today to take a look at pupillary distance, colorization, even the neuropathy of head movement. So we're going to take that beautiful experience of telemedicine and we're going to improve it through PX, or what I prefer to refer to as HX prompting, to make the experience far better for both the provider and for the patient. Stay tuned for the amazing technologies that we're going to see in telemedicine. But in live and real experiences, they want to be able to experience your organization in healthcare across 5 well-defined touch points. And those touch points include the pre-touch moment. And that's really primarily a digital touch moment. In fact, Google calls it micro-mobile moments. It's the time that we're searching for an urgent care or a provider or trying to research a specific disease process. During those micro-mobile moments in that digital research, they have the ability to really understand who's out there and who can provide value. And this is where the best organizations are really thoughtful about the digital properties they use that are not floating brochures on the internet. Rather, they're high-valued resources for patients and prospective patients. We also know the first touch moments, the core moments, the last touch moments, and the way in which we stay authentically engaged with patients are so important. So here's my tip as it relates to consumerism. Number 1, develop a formal human experience strategy. That strategy should take in consideration not just the patient's experience in engaging your product, service, or brand, but it's also about how we create the equilibrium between patient experience and employee, provider, and staff experience. Because it turns out that unhappy employees and staff and providers deliver unhappy experiences. Conversely, unhappy patients deliver bad experiences for stakeholders and providers, which is resulting in stakeholder and provider burnout. If you don't have a plan related to hyperconsumerism, I believe you'll fail. Try to reconsider the benefits of things like patient experience design and replace it with the new science of human experience innovation. Also, remember outdated market demography, looking at patients from ethnicity, from gender, from age, from any of those market demographics is not only, in my opinion, prejudicial, it's also inaccurate. We want to understand our patients from the perspective of the things they love, so we can build upon those, and we want to understand about the things they hate, so we can eliminate those. Interestingly, most patient surveys never get to the core of patient experience. And as somebody with over 40 patents, I can tell you, if you want to invent great things, you need to have great insights. The current insight methods are inadequate. All right, let's talk about something else here in these 3 pillars of what makes up the blur. Technology and emerging technology. There's a lot of hype about AI for good reason. AI is the future of healthcare. AI will significantly reduce the cost of delivering healthcare. It will improve even the patient experience. In fact, there's a study that just came out from the University of California in San Diego that found that patients actually like the experience with the robot, AI, more than they did with the provider. Why is that? Well, unfortunately, we have stressed providers out so much that we've turned these amazing providers and staff and employees into robots. We've been transactionalists. So as you think about technology and the fear that the robot is taking over, don't fear that the AI robot is taking over. Fear that the human robot is taking over. In other words, the way in which we've turned providers, staff, and employees into robots as transactionalists. The beauty of technology is that we're going to let the technology do the work of the things that we humans shouldn't be spending time on, so that they can spend the time to reinvest into humanism. The other thing is that when we think about the black box of AI, it's interesting. I mean, I ran an AI lab at a medical school for 5 years, and I can tell you that, AI is a black box. You plug stuff into it in the form of data sets, and then you get stuff out of it. The real genius of artificial intelligence isn't artificial intelligence in of itself. The real genius of artificial intelligence will really come from what I call connection architecture. What kind of thoughtful, intelligent, smart data can we put into the black box that allows us to get stuff out in a more efficient, and more accurate, and a better way to improve the way in which we deliver clinically, the way in which we deliver to patients experientially, the way in which we significantly improve returns on our organizational strategy, and basically the way in which we do everything better. That's the future of AI, and I think it's exciting. Lastly is the concept of human experience innovation. So what does this mean? Well, if you think about it, most hospitals and clinics are in a complete disastrous state, trying to attract and keep mission critical talent. In fact, many hospitals are only at about 80% of staffing at bedside care. So what has happened is the emerging trend of travel nurses and temporaries. I have a client of mine that is a very small hospital system in Southern California that went from spending $1 million a month on travel nurses to now spending over $12 million. When you look at larger systems, they're spending as much as $40 to $80 million more a month trying to get temporaries in to be able to serve the patient needs. That is not sustainable under any circumstances. So human experience innovation and consumerism are twins. What we really want to do with human experience innovation is to find ways to leverage these new exciting strategies to where we collaborate and engage and co-create with patient-facing, problem-facing, risk-facing, and opportunity-facing providers, staff, and employees. I've been involved in these, and it's so exciting. In fact, I recently did a talk for the Mayo Clinic where I trained over 74,000 Mayo Clinic employees on the concept of joy at work. I know that seems simple in a time of hyper-technology to put joy and happiness as an enterprise priority. But when one of the greatest health systems in the world has set joy and happiness as an organizational priority, it should be a sign to the rest of us that this is the direction that healthcare must go. It turns out that happiness at work is the only way in which we can deliver breakthrough experiences for our patients. It's the only way that we can address provider burnout. It's the only way that we can attract and keep mission critical talent in a time that's a real drought. I mean, we have a real problem trying to attract talent right now. It's the only way that we can get better returns on strategy. In fact, when you apply these principles of human experience innovation with the right tools, check this out, you can get as much as a 60% better return on strategy. I think that's really exciting. The other thing that you can do is you can also reduce cost, you can drive innovation. Everything that you want to do lives within these three DNA components of the blur: hyperconsumerism, technology, and human experience innovation. So let's talk a little bit more about the customer, about the patient. And in my consulting practice, I won't even work with a health system that's not willing to call their patients a consumer. Patients wait for an hour, consumers don't. They want instantaneous, friction-free, beautiful, customized, honest, humanistic experiences. And the best organizations, no matter where you live in the healthcare ecosystem, are developing formal CX innovation and HX innovation strategies. We are in the consumer-driven economy. If you take a look at the moves by Amazon, by Apple, by Google, and by other thought leaders within the technological space, they want to own their piece of healthcare. And they're going to do that leveraging technology to improve the human experience. I think it's a good thing. We are right now in the consumer experience economy, and to the extent that you have a great plan to get better insights and deliver better experiences, you get to win in the next 3 to 5 years. So let's take a look at where some of these apply in the technology space. For one thing is that we are definitely moving towards a higher degree of digitization. We talk a lot about AI, but AI isn't really a thing unless we have the stuff we put into the box, right? We need to digitize stuff to be able to understand the meaning of stuff. And that's what AI does really, really well. So that when we understand the meaning, we can have an output outside the black box to be able to deliver better value. That means that we're going to leverage wearable technologies in a way that significantly improves the way in which we anticipate disease processes. We're going to use technologies to be able to easily act upon asynchronous telemedicine and ongoing asynchronous dialogue with providers and caregivers. We're going to digitize so many things by building out additional sensors. We're certainly seeing the digitization of hospitals. The best hospitals and clinics in the country and around the world they actually have digital command centers now. They're using ambient technologies to be able to listen in to dialogues with providers and patients to improve safety and clinical value. So digitization will be a big part of how we get to consumerization in healthcare. The other point that I'd like to make is that we are definitely going to have to go beyond synchronous telemedicine. Synchronous telemedicine requires that a doctor and a patient is in front of a phone or a desktop or laptop, and that's not efficient. What we need to do, if we're going to deliver care in a time of healthcare worker shortages, with an increasing demand for healthcare, with continued cost pressures, we have to be able to batch. So if you're a manufacturer, you don't manufacture one thing and then reset up and retool for another thing. You build a whole bunch of the one thing, you put it in inventory, and then you build the second thing. That's called batch production. We need to do the same thing in healthcare. And the reason that asynchronous telemedicine works so well is two reasons. One, depending on how old you are, you were raised using asynchronous dialogue in the form of text messages or Snapchat. And when you're used to Snapchat and asynchronous dialogue through text messages, the idea of having a real-time human full duplex dialogue is kind of unusual. So we like asynchronous dialogue. I don't want to make a phone call and call the restaurant, get put on hold to be able to reserve a table. I go on Open Table, in a few seconds, I've reserved breakfast for next Sunday's brunch. That's how consumers want to engage healthcare. They want it asynchronous. Some of them want it synchronous. Some of them want it digital. Some of them want it live. We have to create a bouquet of different services, leveraging digital technologies to improve the way in which we provide care. Asynchronous technology in the next 2 years will be incredibly supported by bots and by really, really smart digital dialogues that only bring the provider in if necessary. And usually it won't be necessary. We are going to see full computerized dialogue in care. And I know that scares some people, but we've been doing it with technologies like buoys and other technologies. Now, here's the weird thing. We have, because of the pressures in healthcare, we in healthcare have turned into robots and we've turned into transactionalists, right? And we see that in the customer experience world in general. And so AI was replacing humans because AI, based on good studies, is more empathetic and human than a human. But now that AI is truly taking over, the one thing that every executive needs to know is we need to get our bots, in the form of our employees and providers, out of the bot transaction business and back into the humanity and humanism business. We'll see this transaction happen in a very, very big way in the next 24 months, where we're going to be freed to do so much more in terms of human interaction with patients because we have eliminated the need to be the bot. That's one of the most exciting things about AI is it's not that it's going to dehumanize care. It's going to provide humans the ability to deliver humanism. And we're going to let the bots do the mopping of the floors and the stuff and tasks that really we shouldn't be doing. Lastly, one of the biggest areas in healthcare that is a problem for patients is in the area of friction. We really need to eliminate friction, and we're starting to see healthcare adopting the practices of consumer-based companies. As you may know, I wrote 2 of the best-selling books on customer experience, what customers crave and what customers hate. And I have a list of the 10 things of what customers hate in my book, what customers hate, or what customers hate. The point is in healthcare is that we need to start adopting consumerism as part of how we do our business, because if we don't do this, we are going to get hacked by the great companies that I personally know that are building out comprehensive CX strategies and human experience strategies. Okay, so let's take a look at this very simple fact. Revenue flows to organizations in healthcare that are building the experiences. Revenue flows to where experiences go. That means the concept of patient experience, which, forgive my vulgarity here, patient experience is a we suck less model. That doesn't work great. We have to be rock stars, and the only way we can deliver beautiful experiences to the patients that trust us and the people that trust us in the B2B space are those organizations that have the equilibrium, right? We have to have the equilibrium of taking care of our employees, our providers, our staff, and also with a focus on them taking care of our valued patients. It's a beautiful thing, and I'm so blessed that I've had the opportunity to see these programs deployed around the world and to see the incredible results these organizations are getting. All right, so let's talk a little bit more about AI, the big buzzword of the day. Again, is AI hyped? No, I think AI is understated. Somebody just asked me a couple of days ago, are we hyping AI to the point where it's exaggerating? No, we are absolutely not. The only real factor here that we have to think about is what does it really mean to us in healthcare? And I think this is what it means to us. Number one, we're going to see tremendous changes clinically. There has been a lot of pushback historically by providers and others where they don't want the robot treating their patient. And gosh, you can certainly understand why, right? We don't want the robot delivering treatment, but the truth of the matter is we're going to see the robot expanding its role in treatment in a really, really big way. So with that being the case, I think that we're going to have to realize that we're going to see some major changes in clinical innovations leveraging AI that are going to be really, really exciting. Remember, doctors will not be replaced by AI, but doctors and providers that are not using AI will be replaced. It's not replacing them, but it will replace the providers that's not leveraging the benefits. From an operational perspective, we're going to see massive improvements in reducing cost. From an experiential perspective, we're going to remove a lot of the pain in healthcare. As we scale up the way in which we deliver care, we're going to also improve both efficacy and the experience. And then lastly, and I think very excitingly, we're also going to leverage AI to be able to anticipate problems, disease processes, and many other things. There's a study that was done by McKinsey, which is really quite impressive, that suggests that robotic process automation, which I think is one of the biggest derivatives of AI, this is one of the most important areas of AI, is going to reduce the cost. Imagine reducing the cost in your organization by 30% by eliminating tasks that can be done through robots. In my practice here, a good third of our stuff is now done through robotics. We're going to see that scale in a really big way in healthcare. We're also going to do a far better job of connecting to things and understanding patient flow. It's hard to imagine a hospital that's not leveraging a command center or a digital command center to keep an eye on patient flow, on all kinds of other data sets to make sure that their hospital or clinic is running with great efficiency. We're also going to see this with people. In our lab, we work on anticipatory technologies, and we're going to see some incredible things that happen. One thing in particular is we're going to see in-ear technologies that will monitor EEG data, core body temperature, true gait. It'll be able to take a look at all kinds of really interesting signals, as much as 35 data signals. It can also be linked to implantables and adhesives. So we're going to really, really be able to constantly monitor a patient and find out if they're at risk of some serious disease process before they come in. And what I love about this is that these are the kind of technologies that can be made available to underserved communities that don't tend to be as good with preventative care, so that we can make sure that healthcare is fair and equitable. And this is something I'm really big on. If you haven't had a chance to see my documentary film, Dr. Ray Powers and myself have made my award-winning film, our award-winning film now available free on YouTube, called The Healthcare Cure. And it really talks about the need to move towards prevention over gratuitous intervention and the need to make healthcare fair and equitable. So if you get a chance, check out that documentary film. So here are the big trends, and I hope that in this short period of time that I've had with you, I've encouraged you to consider the fact that you should have a formal CX strategy. I also believe that the best organizations have a command center set up for emerging technologies with a technology task force. If you don't have a technology task force, you may want to consider it. I facilitate those for my clients, and they are incredibly powerful. They give you the opportunity to take all the weird complexity and bring it into something that's understandable. You know, it's just like LinkedIn. We gotta look at LinkedIn as to what we can ignore, right? It's true with the marketplace. It's true with data. It's true with everything. We need to build out technology command centers and technology groups that are really going to make sure that we know what we should ignore and what we should exploit. And then lastly, the best organizations are attracting and keeping the best talent. They're improving presenteeism, return on human capital. They're doing far better jobs on strategic results. Everything that you want lives in human experience innovation. I believe that all three of these are such an important part of the blur that they really justify building those things out. So I'm running out of time. I just want to say one last thing. In a time of complexity, you as a leader, you as a manager should have one simple priority, and that priority should be acquiring lucidity, understanding what your organization, getting really clear on what should be a priority in a time of complexity, I think is the secret sauce of the best leaders in the world. And I think that what I'm seeing in my research and working with some of the top leaders and some of the top brands in healthcare, what we're seeing is the best leaders are lucid leaders. They're clear. Their team knows what their goals are. Their mission is unshakable. They know what they should ignore. They know what they should pay attention to because they've built out a plan, a CX plan, a technology plan, and ultimately they've built out a human experience innovation strategy. Again, my last advice to you here today is that as you think about all of this stuff, don't be afraid of it because it's exciting. Look, I'm 65 years old. I run an AI lab. I am immersed in technology all the way to here. I love it. We're all going to be able to be in a much better place. Let's lean into the blur. Let's enjoy this incredible time to leverage these technologies and these new practices to impact our patients and our partners in a way that is unprecedented. Thank you so much for taking the time to listen to some of my ideas today.
Awesome. Thank you so much, Nick. It looks like we have a few questions. The first one looks like it might be for Rakesh, so we'll just start there. Paul wants to know, do you anticipate desktop or laptops with powerful CPUs and GPUs or even AI processors used for AI/intelligent automation in healthcare tech applications? And is it already taking place?
It's absolutely taking place, and I'll tell you, I after looking at some of the stuff that they're doing, we're building out a lab right now, and one thing is clear is that the big push for everybody is to be able to do exactly what they're doing. We have to have the capability not just in a mainframe shop. We need to be able to have these incredible capabilities that are ambulatory, that are in mobile devices, that are in laptops. We need to make these things omnipresent because at the end of the day, healthcare will be fueled by AI. And the technologies and the computers that are AI specific are going to rule the day.
Awesome. Thank you. That's great. And then Paul also wants to know, could the emerging intersection of AI, telemedicine, and wearables create an effective and comprehensive patient experience?
Yeah, the beauty of it is that we want to be able to essentially make technology background but address the issue of friction. Here's some of the advantages that all of this will do in terms of the patient experience. We're going to be able to significantly build out far better patient-specific relevancy. We're going to understand their language, their culture, what's important to them. We're going to create those personas, what we call hate-love personas, and through net customer experiences. So the technology will support the uniqueness of the patient, which we haven't been able to do before. It'll also be able to be what I call a digital sidecar. Throughout your entire clinical journey, you will have that phone, that laptop, that desktop as your sidecar to assist you in navigating the experience both clinically and experientially. It's critical to the way in which we deliver patient experiences, no doubt about it.
Great, thank you. And then we have another one asking, how can healthcare providers and organizations effectively balance the demands of enhancing patient experience, ensuring robust data security, and harnessing the potential of evolving healthcare technology in the new era of care?
I'll tell you, the best way from a practical perspective is there is this new body of work. In fact, we do it all the time called enterprise innovation, right? We've got to get better insights from the people that are in our organization to be able to understand where there are needs, problems, opportunities, and risks. And the best way to do that is through things like collaborative ideation. Some people leverage game mechanics and gamification and social engagement, and they use things called enterprise social networks. So there is a framework called enterprise innovation that allows us to gain those insights, to deploy those insights through innovation pipelines. I know this is a lot of words, but and so I apologize, but the good news is that there are systems, and you may want to Google enterprise innovation to look at how you can leverage those tools. We just did a project in Los Angeles where we provided a $10.7 million return on the investment, just using the little Swiss Army knife of enterprise innovation. You can too. I think that's the best place to start your inquiry.
Great. Thank you. Let's see. And then we have another attendee that said, you covered a lot of ground in your talk, so I'm wondering what you consider to be the two biggest trends that will impact the future of healthcare in the next 5 years.
Absolutely. This may not sound novel and not surprising, but AI is bigger than the internet, right, in terms of its impact societally. And when you think about healthcare, we need to do some really weird things that are sort of oxymoronic. We need to reduce cost while seeing more patients. We need to reduce costs while improving clinical efficacy and quality. We need to reduce costs while trying to attract really rock star talent. We need to reduce costs while adding new clinical interventions, while adding. The only way that we can really do that is we have to turn the dirty work over to AI. We have to turn over so much to AI to be able to allow us to do what we need to do, where we have to do a lot more for a lot less. I think AI, without a doubt, will do that. It'll also address the issue of consumer experience. I think the second technology, which is really a business practice, is human experience innovation. And that's where we do a much better job of understanding, collaborating with both employees, providers, and of course, patients. So human experience and AI are the two big technologies that will rule the universe in the next 3 to 5 years, and their impact will be just beautiful.
Great. That's a really great perspective. Okay, and we just have a new one coming in from Aslan asking, how are clinical interventions seen in the future as seeing the AI really being dominant?
I think that we're going to see a major rise in clinical, I do a lot of work in urgent care, I do a lot of work with the top health systems and so on. So clinical can mean a lot of things. But in general, I think that what we're going to do is to see that digital sidecar, which will have the biggest impact from a practical clinical level, to where patients will be able to easily make appointments. And beyond some of the really bad, there's so much bad apps out there right now, but forget those and think beautiful iconery and simplicity. We're going to have digital sidecars that literally are there interacting with patients all the time. Much of it will be in the background. Much of it will be supported with in-ear technologies. We're going to remove a lot of friction while improving clinical quality and patient safety. And that's going to primarily be the way in which they involve with you digitally, remotely, and asynchronously, the way in which they schedule, the way in which they pay, the way in which they verify the efficacy and value of clinical interventions. Virtually every aspect of everything that we do clinically will have a digital supportive sidecar powered by connection architecture and AI.
Awesome. And sorry, I realized, Rakesh, were you speaking on that question about the CPUs and GPUs and AI processors? Wanted to give you a chance to weigh in there if you had some additional insight.
No, I was agreeing with what Nick says, right? Whether it's the desktop or the laptop, there is different kind of compute which is available. Like desktops are typically powered with an amazing CPU. They have paired with a great GPU. So you can run a lot of these AI workloads on a desktop, which is happening already. the aspect that the laptop brings in is that it's more mobile, right? So you can take it around, you can still run different kind of these AI workloads when you're still mobile.
Absolutely. Good point. That's absolutely right. Yep.
Awesome. Looks like we have a couple more questions in here. We have someone asking, are there new strategies that healthcare organizations can apply to address the issue of staffing and rising costs?
Yeah, in fact, I'm speaking at a half a dozen staffing conferences this year. We do a lot in this space. So again, the strategy is human experience innovation. So what does that really mean? It means that we have to do, and I think Mayo is a good example. I could give you dozens of other health systems that made human experience, that is staff and provider experience, a priority. But there is a set of systems and tools and processes. It begins with getting far better insights about what employees and staff and providers care about. Then from those insights, then you build out strategies to remove those pain points. Here's what employees want in healthcare today. They want to believe in your mission, but they also want to be involved in their own personal evolution. And what my clients do under our encouragement is we build out a personal growth plan. Even if you're a small cosmetic practice or you're a small clinic, and I just spoke 2 days ago in Colorado for an urgent care association. If you look at what we need to do is we need to get really vertical and really personal. And that means what I'm encouraging them is to train them and to develop those employees so well that they don't need the job with you anymore so they could leave. And here's what we find out. They don't leave because they want to be in a relationship that's evolutionary. When you think about people that get divorced, the first thing you go is like, oh my God, what happened? The first thing they say, we didn't communicate well and we just stopped growing. I felt like I just stopped growing. It's just as bad when it's a business, right? So the thing we have to do is we have to do a better job of communicating our mission. We have to build personal growth strategies. We do things like happiness hackathons that work incredibly well to be able to get amazing insights. We fix the things that they hate, we bolster the things they love, and the employee satisfaction rises, and then we become the employer of choice. There are unemployed people and there are talented people. There are no unemployed talented people. You have to get people from somebody else, and the only way you do that is with a formal innovation strategy around human experience.
Great insights, thank you. And then, unless we have any more drop in, I have one more question. What is the single most impactful technology to impact healthcare in the next 3 to 5 years?
I think it's pretty easy to say artificial intelligence, but I'll say that with a little bit of a caveat. The term artificial intelligence is way too, generic. We need to provide greater degrees of specificity. So what does that mean, AI is the most important technology? Well, it means to the extent that we will connect it to the right things. So connection architecture, and I believe, RSAs, robotic software automation, are the two derivatives of AI that will have the biggest impact. AI will have an explosively positive impact in healthcare, but we have to ask ourselves then how. It does it through connection architecture and RSAs.
Awesome. Thank you, Nick. It looks like those are all the questions we have. Not sure if there's anything else we want to close off with, but without any more questions, we'll probably be wrapping it up here.
Thanks so much. Listen, I get the opportunity to travel the world and to work with some of the greatest organizations in the world. I really appreciate the opportunity to share ideas with everybody today. But let's look at this with the optimism and the positivity that it deserves. When we lean into this blur and really realize that there are really fun, exciting, cool things that we can do that impact the quality of life of other people, which is why we're all in healthcare in the first place. So this is a good thing. I know it's hard to see that sometimes, but let's take the complexity, let's lean into it, and then let's take these derivatives and bring it to our corner of the universe so we can do what we all got into this for the same reason, and that is to serve patients. And thanks again for having me, you guys. I really appreciate it.
Thanks, folks.
Thank you, everyone. Have a good one.